So please do mute your microphone when you're not speaking. Please do use the chat to put any questions and the feedback in the chat room. And as I said, we are recording tonight, so please do remember to bear that in mind when you're speaking. And please note around a reminder about expressing personal views. So there's a note in the chat around that, because obviously we all do have personal views and we all will be speaking personally, but it's just about showing some degree of respect to other people on the call as well. So tonight, the speakers that we've got my notes blown away. The joy of being outside while the kids are having showers and baths and hair drying. So we've got Yita Stokes, who's from Repair, fellow at Health Education England. So that stands for reducing pre-reg attrition and improving retention. We've got Beth Sykes, who works as a clinician in the West Midlands. She's a clinical specialist at UHB. And then we've got Tamsin Baird from the CSP. She's a professional advisor at the CSP. So these are our speakers tonight. So I want to be mindful that this is a safe space. I want us to be respectful of different perspectives, because some of us will be clinical educators, some will be managers, some of us will be students. And I think the reason why the West Midlands we wanted to put tonight on was that we were aware of some of the challenges that students, the class of 21, have had in terms of competence and confidence, in terms of the positives around having graduated through COVID, their versatility, how agile and adaptable they become. And also just to remind people, I mean, it's 30 years ago this year that I started in my training to be a physio. And it's just about remembering that education is a continuum. It doesn't stop when you graduate, of course. You know, it continues throughout your entire career. And the purpose of putting on tonight was actually how we can help, how we can collaborate as managers, clinicians, leaders, and students and people working in universities, higher education, to actually make things better. And also identify what it is we want to keep from the pandemic going forward. So some of the best bits, you know, it's not about going backwards to how we used to do things. It's about how do we keep the best things from graduate, of course. You know, it continues throughout your entire. Okay, so I'd like to hand over now to our first speaker. So there are slides, and those slides will be available after the talk as well. So we can email them out to you afterwards. So do be careful how many notes you make, because obviously you know most of the stuff on the slides you'll be able to see when you get them. So I hope you enjoy this evening. And if you want any feedback, or if you want to get in touch, you know, the West Midlands emails are available. My email is available. We're all on Twitter. You know, we've got the Twitter account, Facebook account, the Insta account. So you can contact us by lots of different ways, and that would be really great if you chose to do that. So thank you.
Thank you, Phil. I'll just be sharing my screen. Okay, lovely. So yeah, thank you. My name's Tamsin Baird, and I'm a professional advisor for the North East region at the CSP, and I sit within the workforce and education team. I'm delighted to be here tonight to speak to you about the newly qualified workforce and really supporting their transition into the workplace. Okay, so as we know, the pandemic has turned everyone's world upside down, and students are absolutely no exception to this. So I think it's really important to first take some time to acknowledge the disruption that they've experienced. So more or less overnight, their learning was moved online, and their university tutors worked tirelessly to make this transition as smooth as possible. So what did that look like? Many lectures were delivered virtually, and there was less in-person contact, both with patients and also in the clinical setting, as well as with their peers in the classroom. We know that many placements were paused as the workforce navigated this ever-changing clinical landscape themselves. And we also know that practice educators, university lecturers, and absolutely the students very much need to be commended on their approach to this disruption. I think it's clear to say that never before have we seen such fast-paced change, creativity and innovation in physio education, alongside this real attitude and maturity that should be applauded. They quickly appreciate the pressures of the workforce. They got used to wearing PPE, worked within teams, often with competing priorities. They became upskilled in virtual consultations, experienced remote supervision, and managed professionally and personally in really challenging environments. So I want to really reassure you that the class of 2020 and 2021 are not less. They've been required to meet the same HCPC standards of proficiency to become a qualified physiotherapist. And whereas some of them may have had less hands-on experience, because of the education that they've experienced, they will also have considerable strength to offer our profession too. So let's consider these in a bit more detail. So all these challenges that they've faced have meant that we've asked students to become more mature than we normally would, to adapt, to understand and to be proactive. And from our interactions with students, from those that we've presently got with us on placement at the CSP, as well as the many webinars and interaction that we've had with lots of student membership, this graduating class may well prove to be the most thoughtful and versatile clinicians that are created. And time will tell for this, but they've really shown amazing flexibility and have had to find their way through a pretty complex route to get to where they are. So yeah, I've had the pleasure of working alongside 2 students for the past 6 weeks who have asked fantastic questions. They've really risen to the opportunities they've been given, and they've stepped up and applied themselves in a leadership placement setting absolutely brilliantly. So although, and don't get me wrong here, none of us would have chosen the difficulties that these students have been through, and I don't in any way want to minimise this, but their experiences, I'm sure, will mean that they will be huge assets to our workforce for many years to come. And also, when you look at the skills on the screen in front of you there, these are skills that are really difficult to teach, especially in comparison to possibly technical skills. From our conversations, though, we are really aware that there's a concern amongst students that the pandemic may have compromised their ability to be fully fledged physios, and some may feel underexposed to clinical practice. And this brings up the act of feeling ready or not, and levels of perceived confidence that Phil mentioned earlier. Again, I want to reassure you here that this is not new. For those qualified physios here tonight, I'd like you to think back to starting your first post or your first day on a new rotation. Maybe you'd had some placement experience in the setting, but maybe you hadn't. And now I clearly remember the real fear on my first on-call, feeling pretty out of my depth and not believing that I was being trusted with the bleep. I remember also my imposter syndrome that I had on my first morning on my first rotation with an MSK outpatient, and being surrounded by absolute gurus and the fear of not knowing enough. It is quite normal not to feel ready. And that brings us up to this fantastic quote here. Education isn't something you can finish. So this transition between university and the qualified workplace should be a phased process within a really supportive environment to allow for the development of confidence, to allow for any gaps in learning to be addressed, and to provide a really safe space with opportunity for growth. It definitely should not be a cliff edge where education stops when university finishes. Okay, so I really do feel that it's not about minding the gap, it's about bridging this gap between pre-reg and professional working. And I'm sorry, everyone in the West Mids, but I couldn't get away without referencing bridges and not have a picture of Newcastle on the screen. So what is it about? It's about connecting the two in a supportive approach and bringing a real sense of belonging to the newly qualified workforce. It's about analysing an individual's learning needs, reassuring and working towards developing these, whilst leaning on some of those amazing strengths and assets that they can bring. And as we progress through the sessions tonight, we're going to be hearing some fantastic examples of how this can be done. And as you do that, I would like you all to consider what you can do to make this transition easier in your workplace, not just now, but going forwards, to consider the confidence, to consider the health and well-being, the personal and professional attributes, to consider the clinical skills and areas for growth, to enable our newly qualified to really flourish within your setting. It's worth mentioning as well that this will reap benefits to you. So as well as creating a safe culture of learning, it can help with recruitment, it can help with retention and really help with staff engagement. And people want to work in this type of environment. Okay, this is the last slide from me. And I wanted to let you know of a couple of things that are going on at the CSP. So first up, alongside Manchester Metropolitan University, the CSP has launched a practice-based learning resource project. It was just launched at 5 o'clock today. And the purpose of this is to explore the views of practice educators, find out how they can be better supported and help deliver quality placements. And what this will do is this will feed directly into what resources are going to be produced for practice educators. You'll see the QR code there. If you're able to get your phone out and scan that QR code, it will take you straight to a survey where your views can be captured. So just urging you to get involved with that. Next up, for the students who are on this webinar tonight, I just wanted to flag that the CSP has been doing some webinars and some Instagram lives aimed specifically at students. All the recordings of these are hosted on the website, and there's some fantastic info on there. Ones that spring to mind for this topic is a discussion about your physio job, your first job, student leadership, and all things placements. Thank you.